In the winter of 1860, on a narrow plateau above the frozen banks of Clear Creek in the Colorado Territory of the United States, a dispute unfolded that many residents initially regarded as absurd. It began with a door that refused to open. A young miner named Thomas Bell stood outside a timber cabin on the edge of the settlement, his breath condensing in the brittle mountain air. He knocked again, louder this time. From inside came the calm voice of the woman who had delivered nearly half the children in the valley. "Leave the supplies on the bench, Mr. Bell. I will collect them once you have gone." The voice belonged to Elspeth MacLeod, a Scottish immigrant midwife who had arrived in the Colorado Territory 6 years earlier. Born in Inverness-shire and trained informally among Highland healers before emigrating to the United States in 1854, MacLeod had become an indispensable figure in the mining camps scattered along the Front Range. But in January of 1860, she had done something the settlement regarded as deeply troubling. She had locked her door, and she had instructed every household under her care to do the same. No gatherings, no church services, no shared meals, no visitors. Anyone with a fever or rash was to remain isolated. Children were to stay indoors, and no one seen under any circumstance was to enter the MacLeod cabin without permission. The reason, she said, was measles. At the time, measles was considered unpleasant but routine. It passed through communities every few years, particularly among children. In England and Scotland, it was widely treated as an unavoidable childhood illness. Few people in the Colorado Territory believed it required extraordinary measures. One of the first to say so publicly was Reverend Nathaniel Harding, an Anglican missionary who had arrived from England the previous autumn. Harding was a tall, severe man educated at Cambridge, and he carried with him the firm belief that frontier communities required discipline rather than alarm. During the Sunday gathering at the settlement's timber chapel on January 14th, he addressed the matter directly. "Miss MacLeod," he said from the pulpit, "has mistaken a common fever for a calamity. To withdraw from society in fear of such things is neither prudent nor faithful." Several men nodded in agreement. Among them was Dr. Silas Pritchard, a physician trained in Philadelphia, who served the mining district. Pritchard had seen measles many times. His view was typical of American medical opinion in the mid-19th century. "It runs its course," he told the gathering. "Children develop a rash, they rest for a week, and the matter resolves. To barricade homes," he said, "would accomplish little." More troubling, in his view, was the effect on morale. Mining settlements depended on cooperation, shared labor, shared supplies, shared warmth in winter. Isolation, Pritchard argued, would weaken the community far more than the illness itself. Several residents agreed. One of them, a merchant named William Carter, said bluntly that MacLeod's policy bordered on hysteria. "Locking doors over a child's rash," he said. "Next she will have us burning our blankets." The criticism did not reach MacLeod immediately. Her cabin stood slightly apart from the rest of the settlement, surrounded by spruce and lodgepole pine. Inside, the air smelled faintly of pine smoke, beeswax, and dried herbs. A slate board hung beside the window. On it, written in careful chalk lines, were dates and names. January 3rd, first fever reported. January 6th, rash observed in 2 children. January 9th, cough and eye inflammation, spreading. MacLeod had not invented these records. She had learned the habit from her grandmother in Scotland, who had kept similar charts during outbreaks of fever in Highland villages. The principle was simple. If illness followed patterns, patterns could be measured, and once measured, they could be interrupted. MacLeod believed the infection had arrived 3 weeks earlier, not through the miners, not through the traders, but through government officers. On December 18th, 2 territorial inspectors had passed through the valley during a routine survey of mining claims. They had arrived from Denver after visiting several settlements along the South Platte River. One of the men, Lieutenant Edward Caldwell, had a persistent cough during the visit. Several residents remembered it clearly. At the time, it meant nothing, but 12 days later, the first child in the settlement developed a fever. MacLeod recognized the signs immediately. Measles was not new to her. In Scotland, she had seen entire cottages filled with coughing children during winter outbreaks. She had also seen something many physicians of the time underestimated. When measles spread through isolated populations without prior exposure, it could be devastating, particularly in cold climates. The virus weakened the lungs. In warm regions, recovery was usually straightforward, but in mountain winters, pneumonia often followed. MacLeod had witnessed this pattern once before in a fishing village near Ullapool in 1848. 6 children had died within 3 weeks. The difference between mild illness and lethal outbreak, she believed, often depended on how quickly transmission could be slowed. So on January 10th, she began the quarantine. She delivered instructions to families personally. Windows were to remain slightly open for ventilation despite the cold. Shared utensils were to be avoided. Bedding from sick rooms was to be aired outdoors in direct sunlight when possible. Visitors were forbidden. She also recommended a traditional treatment she had used in Scotland for generations. Children with fever were given warm barley water mixed with honey and small quantities of elderflower infusion. The drink did not cure measles, but it eased coughing and encouraged hydration. For skin irritation caused by the rash, MacLeod prepared a bath of oatmeal and chamomile. The purpose, she explained, was simple: keep the body calm, keep the lungs clear, and above all, prevent the disease from moving quickly between households. Many residents quietly followed her advice, but the settlement itself remained skeptical. In the mining camp ledger for January 18th, a note appears beside the supply accounts. Miss MacLeod refusing visitors again, claims contagion. Dr. Pritchard disagrees. By the 3rd week of January, tension had grown noticeable. Families divided over whether to attend church services. The general store saw fewer customers. Reverend Harding wrote a letter to a colleague in England describing the situation. The midwife here, he wrote, has convinced several households to withdraw entirely from society, under the impression that measles requires siege conditions. Harding believed the practice bordered on superstition, yet MacLeod continued her routine quietly. Each morning she recorded temperatures using a mercury thermometer imported from Boston. Each evening she marked new cases on the slate chart. She also noted outside weather conditions. January temperatures that year were unusually severe. Nighttime lows often reached -18 degrees Celsius. Cold air increased the risk of lung complications. MacLeod suspected the combination measles plus winter exposure could prove dangerous, but in January of 1860, no such audience existed, only a small mining settlement watching a locked door. What most residents did not understand was the principle behind MacLeod's decision. By the mid-19th century, the germ theory of disease had not yet been widely accepted in England or the United States. Many physicians still believed illnesses spread through miasma, which means bad air or environmental imbalance. But rural communities often relied on practical observation rather than theory. MacLeod had seen something repeatedly in Scotland. When measles entered a village gathering, church, market, harvest celebration, the number of sick children doubled within roughly 10 days. When families remained separated, the spread slowed dramatically. Modern epidemiology would later describe this using the concept of transmission chains. Measles is highly contagious. In unprotected populations, one infected person can pass the virus to roughly 12 to 18 others. But that requires contact. Interrupt the contact and the chain weakens. MacLeod did not know the virus itself, but she understood the mathematics of proximity. Her slate board showed it clearly. The first infected household had 3 children. If those children attended church, they might interact with 30 others. Those 30 might bring the illness into 15 more homes. Within 4 weeks, the entire settlement could be infected. But if households remained separate, each cluster remained small. Her charts showed an average of 2 new infections per household instead of 10 or more. That difference, though subtle on paper, would soon face a severe test. The winter storm arrived on February 2nd. Meteorological records from Fort Laramie indicate a strong Arctic front moved across the central Rockies that week. Snowfall in the Clear Creek region exceeded 60 centimeters within 3 days. Temperatures dropped below -25 degrees Celsius. In ordinary winters, residents would gather indoors for warmth, but now many homes contain children recovering from measles, coughing, weak lungs, fever. In households that had ignored MacLeod's quarantine, the situation worsened quickly. 4 children from the Carter family developed severe respiratory symptoms within 48 hours. Dr. Pritchard recorded the cases in his notebook. Complication of lungs following measles eruption, breathing shallow, chest congestion. 2 days later, pneumonia appeared. Across the settlement, similar patterns emerged. Yet the homes that had followed MacLeod's isolation instructions showed a different trend. Fewer children were infected simultaneously. Rooms remained ventilated despite the cold. Herbal infusions and hydration reduced coughing. Most importantly, infected households were not receiving visitors. The difference became measurable by mid-February. MacLeod's records listed 25 total measles cases among quarantined households, 3 severe lung complications. Dr. Pritchard's district log, covering the rest of the settlement, recorded 60 cases, 28 severe lung complications, 9 deaths. The numbers forced attention. Reverend Harding visited the MacLeod cabin on February 18th. This time the door opened. Inside, he found the slate board. He also found a ledger. MacLeod had been keeping detailed records of every household she advised. Dates of fever onset, rash appearance, duration of cough, recovery times. She also kept temperature readings inside and outside the cabin. The interior temperature averaged 12 degrees Celsius, cool but stable. Windows were opened briefly each morning for air exchange. Harding copied several figures into his notebook. Later that week, he wrote another letter to England. His tone had changed. "The midwife's method," he wrote, "appears to have limited the spread considerably." Dr. Pritchard was slower to concede, but he examined the numbers himself. By early March, the outbreak had largely burned through the settlement. Final counts showed a stark contrast. Households following MacLeod's quarantine, 25 infections, 3 severe complications, 0 deaths. Households that continued normal gatherings, 70 infections, 31 severe complications, 12 deaths. Pritchard recorded the comparison in his medical journal. He wrote simply, "Isolation of households appears to have reduced spread significantly." In April of 1860, the territorial administration requested copies of MacLeod's charts. By summer, mining camps along the Front Range began adopting similar measures during outbreaks of measles and influenza. The approach spread quietly. No proclamation, no ceremony, just practical imitation. Within 5 years, quarantine guidelines appeared in several territorial health notices. By the 1870s, public health boards in parts of the United States were recommending temporary household isolation during measles outbreaks, a practice that MacLeod had applied instinctively from Highland tradition. Decades later, historians examining early disease control in the American West discovered the Clear Creek records preserved in county archives, temperature logs, infection charts, supply ledgers noting reduced travel between homes. In 1912, a paper in the Journal of the American Public Health Association cited the case as an early example of effective rural quarantine. Modern epidemiologists reviewing the data found the pattern entirely consistent with contemporary transmission models. Interrupting social contact reduces spread. Ventilation lowers viral concentration indoors. Hydration and supportive care reduce complications. None of these principles were unknown in 1860. They were simply undervalued. Today, the MacLeod cabin no longer stands, but the settlement records remain. In a quiet archive in Colorado, the slate board entries have been copied into typed transcripts. Dates, names, temperatures, evidence. They show something historians encounter repeatedly. Expertise does not always arrive through institutions, and familiarity with a problem is not the same as understanding it. In 1860, a midwife trained in Highland villages recognized a pattern others dismissed. She acted on observation rather than authority, and the numbers settled the argument. Physics, biology, and disease transmission operate without regard for reputation. They respond only to conditions, and when those conditions are measured carefully, even a locked cabin in the mountains can alter the course of an outbreak.